All right, welcome back to Pharmacist on Call, your 1 hour forum. Your doctors are busy, your pharmacists are busy, they don't have time. For this hour, I do. So call in with those questions and those comments. We're going to get right back into your calls here. And we got Benny. Welcome to Pharmacist on Call. How may we help you?
Hey, Doc. I want to thank you for the beetroot juice. And it will surprise me. My blood pressure went down so low, it kind of scared me. It's never been in the 60s, that lower number.
Oh, okay.
Nurses are saying it's perfect. You're perfect. And my AC1 came down to 7.3.
From where?
From about 7.6, 7.8.
Okay.
It came down a little, but I got to get rid of them donuts.
Yeah, even with the donuts, it still came down.
Yes, sir.
Good stuff.
They're saying it needs to come down lower. Do I need to go, around a 6 or a 5?
Yeah, our goal for diabetics is around a 6 for an A1C.
Okay, I forgot to ask him, but I just want to let you know, and I haven't started the CBD oil.
Okay.
And I'm going to start that this month and see what it does for my pain and my fibromyalgia pain.
Okay, I think you'll like it. Most of the people who come in the store, it works quickly because you put it under your tongue. It's in your bloodstream in about 15, 20 minutes. So everyone who has bought it has said that it has helped their pain.
Yes, sir. I'm trying to get off the opioids like the lady before it called, and I'm on high doses of that. That's the reason I'm going to try something different.
Yes, sir.
Opioids. But I want to tell you about the beetroot juice, so I thank you much. I'll let somebody else call
All right. I am glad it helped you.
Me too. Thank you so much.
Yes, sir. Thank you.
All right. Bye-bye.
All righty. Bye-bye. All right. So I guess we'll get into some supplements here, but I did want to mention another happy birthday to the devastating sorors of Delta Sigma Theta. So ladies, happy birthday. So they will be celebrating, I forget what your anniversary is, but it will be this Saturday. So all you sorors out there, especially my close friend Chandra Wynn and Felicia Young, so all of y'all, happy birthday. And hopefully I'll see you all out celebrating at some point. So we're going to get into a little discussion about the CBD oil here. So we weren't able to really discuss it. I just want to give you a little background. So there are a set of receptors in the body called cannabinoid receptors. So this means that the creator who put this plant here also endowed our body with receptors to be able to respond to it. Now the cannabinoid 1 receptor was discovered around 1988, and what they found that, when it came in contact with THC or CBD, that it had central nervous system effects. And so it helped people with certain psychiatric conditions. Roughly about 5 years or so after that, they discovered the CB2 receptor, which is the cannabinoid 2nd receptor. It's primarily found in the periphery of the body and in some of the organs. CB1 in the central nervous system in the brain, the spinal column, and all of that. So the two predominant cannabinoids in the body, well, not in the body, THC affects CB1, CBD affects CB2. So CB1, so all of those people who, smoke marijuana, you have the THC. The reason it gives you that euphoric high is because it affects the CB1 receptor. For those of you who have been taking the CBD oil, and once it interacts with CB2, you all have been getting the health benefits. So high and healthy. CB1 high, CB2 healthy. So those were the two receptors. They're the two most predominant. There are about 115 endocannabinoids in your body. So each one elicits a different effect. Well, in marijuana that your body responds to. So for the purposes of what we carry, our first product contains, let's get a bigger bottle of it. Our first product contains CBD plus THC in small amounts. So the legal limit is less than 0.3%. This is around 0.2%. So this is the broad spectrum form. It not only has CBD and THC, but it has a broad spectrum of different cannabinoids. So what this formula is designed to do is to help a multiplicity of health conditions. CBD helps a lot in and of itself, but when you add in the other cannabinoids, it has an effect on other things in the body, your nausea, your pain relief, anxiety. So this is the broad spectrum formula, and we call this the formula green, probably because it has THC in it. Now, for those of you who are reticent about trying CBD, don't be. It will not show up on a drug test because even though it has minute amounts of THC, this will not show up on a drug test because it does not produce the metabolite that we test for in a marijuana test. So you are okay if you're hesitant, you think you're gonna fail a drug test at your job or whatever else, no fear. The amounts are so small that you're not gonna produce the metabolite anyway. And the second one that we have is a black formula, and this is straight concentrated CBD by itself all alone. And so CBD elicits effect on just a number of things, primarily for pain relief, some nausea, fibromyalgia. Those of you who have called in over the years for neuropathy, this is a good option, even though this one is too, but this is concentrated specifically for different types of pain. So whether you have like visceral pain, neuropathic pain, a lot of you are talking about back surgeries and knee surgeries, a lot of you who are on opiates, this will also help relieve your pain. So the combination of the two are used to treat, as I said, neuropathic pains, whether it's neuropathy or fibromyalgia or just chronic pain. It is also used to help treat depression because cannabidiol increases the serotonin levels. And so serotonin is our happy neurotransmitter, so helps us feel better. It also helps bipolar disorder in that it affects a substance called anandamide. So it kind of shuts that down, which produces dopamine. And in bipolar disorder, we have highs of dopamine and then, we go down. So during that manic phase, when you can't sleep and your thoughts are racing and you're having word salad, what CBD does is push down that dopamine, so that you don't have those symptoms. So psychiatric effects, PTSD, so a number of them, anxiety as well, because the serotonin also has a role in treating anxiety. So helps with serotonin, helps bring down dopamine. Also produces, there are some studies to show that it does signal transduction in terms of helping to treat cancer. And so what we call that is apoptosis. What happens is there's a chemical called ceramide, I believe, and in the absence of this ceramide, cancer cells are allowed to run free and grow and all that. Once it interacts with cannabinoid CBD, shuts it down, stimulates apoptosis, which is programmed cell death. But it looks like we're up on another break, so we're gonna have to come back to that. We'll be right back.